As the country inches towards the end of a second national lockdown instituted to stem the second wave of COVID-19 infections, Health Minister Dr. Ruth Aceng has revealed that the number of infections has drastically dropped from 34,247 cases nearly 2 months ago to now 677.
Although there is a steady drop in the number of confirmed cases, mortality continues to occur among the severe and critically ill.
The minister also assured the public that her ministry has managed to implement a number of measures to strengthen the country's response to the pandemic. These, among others, include enhanced financial support to district COVID-19 task forces, enhanced availability of PPEs for health workers, in-service training for health workers on treatment and care for COVID-19 patients, as well as the procurement of 3 cryogenic oxygen plants.
We are buying 2 types of oxygen: the cryogenic or the liquid oxygen, and the pressure swing adsorption, which is the gaseous oxygen.
However, the ministry admits it fell short of its target of vaccinating 22 million Ugandans before the end of the lockdown due to a shortage of vaccines in the global market. As of today, 1,139,260 doses of AstraZeneca have been administered to 902,293 Ugandans as the first dose, whereas 232,743 doses have been administered as second doses.
Much of what is produced is taken away by the rich countries that had paid prior during the research and development process. As such, most African countries are unable to access adequate vaccines in spite of availability of funds.
In order to increase access to vaccines in the country, government has decided on a number of measures. First, private organizations with a capacity to procure their own vaccines have been given the go-ahead to do so through the national medical stores.
This is to ensure quality, safety, and maintain the cold chain. The Ministry of Health will allocate health workers to carry out the vaccination. Regarding the purely private sector for sale of vaccines to the general public, this channel is important to increase access to vaccination.
Secondly, Ugandan embassies have been instructed to search for available vaccines in the market and to coordinate with an interministerial committee that has been instituted to decide on those that are viable for use here in the country. However, Ugandans have also been urged to remain compliant with the COVID-19 SOPs, especially if the country is to stave off a third wave of the pandemic.
If we do not maintain the SOPs to actually prevent spread, we will definitely get a third wave. As of June, about 30% of the countries in Africa.
Currently, Uganda is expecting 9 million doses of AstraZeneca from the COVAX facility, as well as 2 million doses of Johnson & Johnson from the African Union. Joyce Nakato, NTV Tonight.